As some of you may know, today is the last day to sign up for health insurance this year in the marketplace. As you can see by the lines around the country, this weekend we are seeing a surge in enrollment. More than 6 million people have signed up, a remarkable statement given where we started back in October. A few basic facts to remind you of. If you don't have insurance, today is the deadline. If you don't sign up, you may not be able to get coverage until next year. More and more Americans are finding quality, affordable coverage. 6 out of 10 people without insurance can get coverage for $100 a day or less. We're encouraging everyone to spread the word to their friends and family. You can sign up at healthcare.gov, get help in person in your community, or call the healthcare call center at 1-800-318-2596. That's 1-800-318-2596 for help in 150 languages. With that, I will take your questions.
Thanks,
Julie.
Jay. Is it that surge in enrollment that is causing healthcare.gov to be down right now?
There is a technical problem that the tech team is on. There are currently 100,000 people in the system who are enrolling, and there is no problem for them to enroll. For the causes of different glitches that are being addressed, I would refer you to CMS. But as has been the case all along, when there's a problem like this, it gets addressed and addressed quickly.
We just haven't been able to get an answer to this this latest one. This morning we were told that it was a software glitch, it was not a volume issue. So I'm just trying to figure out if it's a volume issue that you're dealing with right now, or if it's...
Sure, and what I'm telling you is that I would refer you to the experts in terms of, because this is obviously very fast. Well, I think they're working on it, and when they can give you an answer. What I think is important, because I know there's been a lot of focus on glitches, is that there has been a remarkable story since the dark days of October and November, which has resulted in a situation where here on the last day of enrollment, we're looking at a number substantially larger than 6 million people enrolled. And I dare say that there are few people in this room, including some of the folks who work in the White House, who would have predicted that we would get to that number. And it's because of the remarkable persistence and hard work of the teams that fix the problems at healthcare.gov. And it's because of the determination of the American people who so clearly demonstrated their desire for quality, affordable health insurance that they would not be deterred despite the problems that the system initially presented and which had to be fixed. So you're seeing, some pretty incredible things, including more than 6 million people, as I've said, having signed up. We saw people lining up around the block this weekend, 2.9 million visits to the website this weekend, and last week alone we saw more calls to the call centers than in all of February. No one expected us to come back from the brink or to surpass the revised CBO projection that 6 million consumers would sign up in year one, but we have, and I think that merits noting in your reports.
Do you know when we should expect to get a final 6-month enrollment figure? And does the president have any plans to sort of mark the end of this 6-month period in any way?
In terms of the final figures, obviously these are things that include not just the figures from the federally run marketplaces, but state marketplaces. So there's figures that come in and are tabulated and aggregated and then presented to you. So I wouldn't predict at this point when we would have the final numbers. As you know, as was the case in December, there will be an opportunity for those who have initiated the process but aren't able to finish it by midnight tonight to ensure that they get signed up for health insurance. And we won't know what that universe of people looks like until we get past the deadline tonight. So what I can tell you is that we expect the numbers to be significant, as we've seen in this period towards the end of the open enrollment period. As we predicted all along, there would be a substantial number of people who at the very end would, when faced with the deadline, enroll, and that's what we're seeing.
And anything about the president planning to
I don't have
this in any way?
I don't have any scheduling announcements for the president. He's obviously briefed regularly on the operations and the numbers as they come in and as they become available, and is gratified by what he's seen in terms of the interest that the American people have demonstrated, the lines over the weekend, proving again that there is a huge appetite across the country for access to quality, affordable health care. And as promised, there will be millions of people who have signed up through this system. And we have yet to see from the critics who are now grasping for other things to criticize about the Affordable Care Act and the enrollment process, an alternative that doesn't include taking that insurance away from millions of people and telling people that if they have a pre-existing condition, they're once again at the mercy of the insurance companies, and telling women that they may be charged double what their identical twin brother is charged just because they're women. And these are the kinds of things that the Affordable Care Act eliminates. They're positive benefits that the American people can now enjoy. And we have been about the business, despite the trouble with the rollout in October, of implementing a law that was designed to provide the American people some security that they lacked when it came to access and affordability to health insurance.